On Lagos television. Now, our discussion today is one that is of importance to public health, and I am talking about malaria. We'll be looking at prevention, treatment, and management in Lagos. Despite being preventable and treatable, it still remains a significant cause of illness. And even the World Health Organization's Global Technical Strategy for Malaria, the global targets include reducing malaria case incidents and mortality rates by at least 90% and eliminating malaria in at least 35 countries by 2030. Now, this is 2025, so it's just 5 years to go. Now, joining us to shed light on the strides being made here by the Lagos State government is Dr. Abimbola Osinowo. She is the manager of the Lagos State Malaria Elimination Program. You're welcome, Doctor.
Thank you very much, and thank you so much for having me.
Glad to have you here. So let's begin with understanding the current state of malaria in Lagos State.
Okay, before we come to Lagos, let's start globally. Malaria burden globally is about 268 million. So that means that malaria cases, this is as at 2024, it was 268 million individuals that were discovered to have malaria. Out of that 268 million, 95% of them come from sub-Saharan Africa, and Nigeria is one of them. Now, the statistics for Nigeria is actually quite staggering because that 95%, 27% actually come from malaria. So definitely, malaria is quite important in Nigeria. So now, if you do 27% of the 268, it comes to almost about 68 million individuals having malaria in Nigeria. And why malaria is quite important is because it affects pregnant women and children under 5. And these are the indices that are being used to assess how a country is. If the indices are quite high for malaria, for mortalities in these two individuals, definitely the country isn't doing well. So based on that, we are looking at a situation where malaria affects these individuals, causing morbidity and mortality. It affects everyone, but it can be quite severe in these two. They're what we call the vulnerable groups. So definitely malaria is quite important. And in Lagos State, over 900,000 individuals had malaria last year. So it's 900,000 individuals
had malaria last year.
Had malaria last year.
All right, so let's understand. You are the manager of the Lagos State Malaria Elimination Program. Now, let's understand the goals of this program.
Malaria generally, the ultimate goal is actually to eliminate malaria from Lagos and by extension, Nigeria. But then it's not just a one-size-fits-all project. In Lagos, the prevalence of malaria is actually the lowest in the country, 3%. Meaning that as much as we are doing well, we still have a long way to go. Malaria is not just about, when you talk about malaria, a lot of times you think about, you're ill, you go to the hospital, and then you take medications. It goes beyond that. There's a prevention arm, there's a diagnosis arm, and then there's a treatment arm. The prevention actually takes the chunk of how malaria is going to be managed and is multifactorial, multi-segmental, meaning that it has everybody's involvement. We look at malaria from the health perspective, but there's also the environmental perspective. There's a housing perspective. There's the education perspective. There's women affairs, poverty alleviation. When you put all of that together, it actually helps to reduce and eventually eliminate malaria from the state and the country. For the environmental perspective, I'm not going to talk about the health because everyone is very familiar with that. But from the environmental perspective, the way our environment is actually determines whether we are breeding mosquitoes or not. And once you've gotten rid of the breeding sites, you have done half of the work. So we're looking at our gutters. Are they flowing? Do you have areas that drainages are not working or are not functional or not even available? Let's talk about education. A child, once you teach a child, the child is your advocate for life.
Yeah.
And they run with that information. So if we educate our children, be rest assured, they're going to harass their caregivers to abide by what is expected of them. The teachers at the same time, they have monopoly over a number of children. So if you educate the teachers, that information can be passed
to the children.
To the children. let's talk about our housing. Our houses, the way they are structured, fortunately for us, in this part of the country, many of our houses are made from cement. So what it also means is there are some activities that we do, or some interventions that we do, like indoor residual spraying, such that when we spray these homes, the insecticides that are being used are retained on the wall, which would eventually prevent the mosquitoes from breeding and then from being transmitted and from breeding, and then eventually the mosquitoes die. So at the same time, when these houses are being constructed, if they are not, the materials are not good, they can actually be, they can assist with mosquitoes being able to come in and out. That, or even the way we construct it. For instance, if we use thatched, like I said, we are fortunate in this part of the world where this part of the country where the houses are constructed properly. But then if you look at our shanties, areas, slums, urban slums and all of that, which we have a lot of in the States, those areas actually can help with breeding. Then I talked about the environment. You remember the different, should I say, rubbish dumps, they can serve as breeding sites. These dump sites can serve as breeding sites. I talked about women affairs and poverty alleviation. You know, when a mother is educated, the whole house ends up benefiting from it. And then when a woman is empowered, the same thing. So definitely that's where they come in. So when it comes to malaria, it's multifactorial. And then we also need money to be able to do all of these things. So the Ministry of Finance is also quite economic planning and budget. They're also relevant to malaria elimination. So it's multi-segmental, multifactorial. It has a lot of activities. Our communities, once the community is empowered in information, relevant information of how to prevent malaria, they can run with it and ensure that things are happening. That is the aspect. Then as individuals, a pregnant woman is expected, before I even come to pregnant women, let me talk about the nets.
That's the mosquito net?
The mosquito net, insecticide-treated nets, ITNs. Where we're expected to use them, because mosquitoes are the ones that transmit the parasite responsible for malaria. So if you sleep inside the nets, we are protected. If we ensure that our environment is clean, our areas of influence are around our homes, we do not have containers or refuse hanging around that would eventually lead to breeding sites, then definitely would clear the mosquitoes around us. And then containers, water containers. Some homes do not have water. Those containers are actually stagnant water, and they are breeding sites for mosquitoes. Then some of us are plant lovers. There are some plants that their leaves are quite wide, such that water collects. Mosquitoes do not really require much to reproduce, much water to reproduce. So if those collections are there, they serve as breeding sites. And then we have pots and pans all over the house, serve as breeding sites. So if we can, our area of influence, if we can, ensure that it's properly managed, the environment is properly managed, modification, manipulation, definitely we are on our own part doing the work. Then in front of your homes, gutters, are they refuse dump areas? And it's a collective activity. Even if I decide that I'm going to do the right thing, if my neighbor isn't doing the right thing, it's not going to add up. Because let's look at our gutters. My gutter is clean, but I'm not the only one that has access to it. Water is coming from my neighbor's house into that gutter because it's going to flow in front of me. If my neighbor decides to block or use refuse to block the flow of water, in front of my house eventually has stagnant water, which ends up being breeding sites. So everybody has a part to play.
Now let's take it down to the roots now. You have highlighted that mosquitoes are the carriers of this parasite. But again, are there other ways that people can get infected with malaria aside from mosquito?
Mosquito is the only parasite responsible for carrying the malaria parasite.
Because I read somewhere while preparing for the program that some get it from blood transfusion, organ transplant, and I'm like, wow.
Okay, so mosquitoes are still responsible for transmitting the malaria parasites. However, because they reside in the blood, so any way or anyhow, blood is being obtained by transfusion or any means then definitely it can be transmitted. For instance, a mother can transmit the parasite to an unborn child. So the mother can actually have malaria, and the child too can eventually develop in the course of pregnancy. If there's any reason to have blood transfusion, that can also be transmitted. But the mosquitoes are responsible for transmitting the malaria parasite.
So some people too can be carriers of the parasite?
Yes. Particularly the fact that we live in an endemic environment. Some of us are asymptomatic, meaning that we don't show the symptoms, but then you probably would have the parasite within you.
All right, you've talked about the high risks that pregnant women and children under 5.
Yes.
So how do we take precautions now? Because I know pregnant women, every 3 months, they treat you for malaria. So how do we now take precautions, especially for these vulnerable groups?
Okay. The vulnerable groups are, like I mentioned, pregnant women and children under 5. And why so? Because, like I mentioned as well, the indices of a country is actually determined by these individuals. So if the mortalities in these individuals are high, then the country isn't doing well. And how do we prevent malaria? Very simple. Sleep inside the nets. Mothers are expected to sleep inside the net. Pregnant women are expected to sleep inside the net. Everyone is expected to sleep inside the nets. Now, for the pregnant women, when in their second trimester, they take what we call intermittent preventive therapy in pregnancy. And it's a drug, sulfadoxine pyrimethamine. 3 tablets in 1 sachet they're expected to take. Why they take that is just so that they don't have malaria while they are pregnant. And once they start in the second trimester, they're expected to take it monthly until delivery. So that's why we encourage our women to ensure that they start their ANC on time, antenatal care on time, because once they start on time, it's easy to pick them, such that by the time they are pregnant, by the time they get to their second trimester and they commence the medication, they can have up to 5 doses before delivery. And what that does is that from the third, once a woman has taken 3 doses, she's protected in that pregnancy, meaning that she's protected from malaria for herself, she's protected from malaria for the child, unborn child. So it's a win-win situation. So those are the 2 ways that we ensure that these individuals are actually protected from malaria.
So before you talk about the child, I just want a follow-up question to pregnant women. So I've heard people say, when a child is born and is down with jaundice, I've heard people say, oh, the mother did not treat malaria while she was pregnant. So is there a relationship between not treating malaria in pregnancy and the baby having jaundice?
Jaundice, the cause of jaundice is actually a different ballgame altogether.
Okay.
And it's normally noticed after the child is born. It's really most times not related to malaria. No, it's more of the blood breaking down. And then bilirubin is expressed, and the places that are exposed eventually are noticed to be yellow. And then if treatment isn't commenced or management isn't commenced on time, then the child can actually even become severe, result severe jaundice. And there are so many sequelae of bacteria or untoward effects that affects that child.
So for children under the ages of 5, how do we also, aside from using the insecticides, treated nets now, what other things can parents do? This
is not just for children under 5, it's general for everyone. It's expected that if a child is ill, or if anyone is ill, make sure you get tested before you start on any form of medication. Why? Because there are so many causes. Most times when an individual has fever, which is a lot of times the first symptom that people complain of, it isn't malaria. It doesn't necessarily have to be malaria. There are many other causes of fever.
Because?
Malaria being one of them.
Yeah.
We have diarrheal diseases that can present with fever. COVID-19, the first symptom was actually fever, and it looks like malaria. Even Ebola, fever. Common cold, person can have fever. Different is respiratory disease, pneumonia, fever. Even stress can present with fever sometimes. So we want to be sure that it is malaria, and the only way that can be done is by testing. And the form of test we do for malaria is either using malaria rapid diagnostic test kits, the MRDTs, or the blood sample is taken and checked under the microscope. If it is positive, then the person can take ACTs, the artemisinin-based combination therapy, the approved medications for treatment for malaria. So for children and for everyone, that is how it's expected to be taken care of.
You know, you see, you just said now, because a lot of people just, oh, you have fever. Are you sure you don't have malaria? And because the medication is accessible, you just go to the pharmacy and get a anti-malaria and take. So I really need you to, you know, educate everyone on the importance of testing before treatment and also addressing self-medication.
Like I said, it is important to test before you treat. Why? Because many causes, there are so many other causes of malaria. And if you remember, chloroquine was a drug of choice for malaria treatment a while back. Unfortunately, it's no more so. Why? Because we have abused the use of the drug, resulting in resistance, malaria resistance, and then the drugs became ineffective. So you are treating a situation whereby you are treating a disease that isn't within you. And drugs are poisons, whether we like it or not. If you are not using it for what is not meant for, you are allowing your body do work that is not necessary. It's affecting the liver, it's affecting the kidneys. And you can imagine taking it periodically. Oh, you haven't even found the cause of the problem, and you are treating, so to speak. You're not treating the main cause. You're just taking medications for taking sick. If, for instance, you have a viral infection and you decide to take ACTs, chances are the virus or the infection would go, and you would now ascribe the ACTs to malaria. Meanwhile, it isn't. So why we are educating, or why we are insisting that you get tested, is because we don't want a situation where you're just taking medication for taking sick. We want to know the problem, the cause of the problem, and then that is properly treated. If it's a diarrheal disease, for instance, or a respiratory tract infection, for instance, we know that that is where the problem is, and we start the proper medication. But then when it's malaria, when you claim it's malaria, you probably won't get better. And the prognosis, or should I say, the disease would eventually become worse, and you now start claiming it is still malaria. Meanwhile, it isn't.
It's advanced to something
It can result in something else. And then it can now become more severe, such that if you had started proper management earlier, it won't have been in that situation. The other thing is we don't ensure where we have resistance to ACTs. Like I mentioned, chloroquine was what we were using before malaria parasite became resistant to it. We don't have any other medication that we're using at the moment for the treatment for malaria. It's only ACTs. And if we have resistance to it, it means that
there's a problem.
There will be a problem. So we're encouraging that you test and be sure that it is malaria before you start any form of medication. Not just for malaria, but for diseases generally. So we know what the root cause is, and then we deal with that root cause as is.
So what's your view on the use of herbal remedies now? The agboiba. Because on this side, it's something that is very common here, and people just, oh, no more agbujari, well, get arrest. So what is there a benefit, or are there health risks?
A lot of our drugs are actually made from herbs. The artemisinin that we mentioned, it was actually Chinese herbs. It's from China that it was first used, and it was noticed to have worked for malaria. Unfortunately, what happens with herbs is we don't know the quantity. Everybody just takes it as is. You don't know the quantity that may be right for you or may be adequate to solve a problem. And like I mentioned, these things are poisons when they are not used appropriately. So what would happen is the liver is affected, the kidneys are affected. So what I would suggest is desist from them. Because a lot of times, it's a lot of concoction. Sometimes they even put anti-malarials in these medications, in these herbs that are being sold. Yes, they put some anti-malarials in them, such that it will look like it is working. And somebody can imagine somebody making a concoction and adding a lot of anti-malarials inside of them, and then selling or dispensing as is. You can imagine the quantity that is within those individuals that consume them. It may not be very good. And it's your kidneys that you're dealing with, it's liver you're dealing with, and the rest of your organs in the body that can be affected. So I would tell the individuals to desist from these things, because they're actually not good for your health.
Some will say, but it's natural.
As much as it's natural, medications are actually being, should I say, let me put it this way, you know the quantities to take.
The dosage.
The dosage, they've been dosed for us to know take two tablets in the morning, or take one tablet now, and then the next 8 hours you take another one, then the next 12 hours you take another one. There's a dosage to it. But with herbs, they're just drinking. They're not realizing the quantities or knowing the quantity they are expected to take. So desist from them.
All right. Are there certain foods or drinks or even medications that people should stay away from while treating malaria?
A lot of times, for anti-malarials, not quite. But there's some, I think what will happen is, what I would suggest is every brand has its own peculiarities. So just follow the instructions based on the leaflets within the medications that you have bought. There are things, or there are some contraindications that are written there. Everyone has their own contraindication. Every medication has its own contraindication. Just follow the instructions as required.
But you say don't take vitamin C when you're taking anti-malaria, don't take oranges.
That's why I said follow the instructions.
So it differs?
It can differ.
Oh.
Because there are so many brands of anti-malarials, there are so many compositions. So every one of them has its peculiarities. So what would suggest is just follow what is expected or what has been written in the leaflets within the packages.
I used to think that when you're just taking anti-malaria, stay away from vitamin C. I learned a lot today. So now, the Lagos State Malaria Elimination Program, how are you engaging the community, especially those at the grassroots, in the fight against malaria?
A lot of awareness creation is going on, not just by the government, but by community-based organizations. Government can't do it alone, so we need help from others. And those others, that's basically what they're doing. So they're doing a lot of interpersonal communication, a lot of one-on-ones. Sometimes they can decide to have meetings with the CDAs, the members of the communities. So it's a lot of activities, sensitization with the stakeholders, relevant stakeholders within the communities, the groups, the youth groups, the religious leaders, everybody that is important within the community that has a form of authority or leadership is engaged, such that they can help transmit the information about malaria prevention within their spaces.
So how have you been able to manage progress now of work of curtailing malaria in Lagos State?
We have our data which speaks to us, and we do surveys as well. And these are the indicators that there are certain indicators that we actually look at to see whether we're doing well or not doing well. And that's why we kind of encourage everybody to ensure that, do the needful, because our data speaks for us. If the data is not doing well, then it looks like the state isn't doing well. If the data is doing well, then it looks like we know that we're doing well. So everybody, that's what it's relevant that everybody does his or her own bits, because little drops of water definitely makes a mighty ocean. So once you do your own bits, we're not even asking you to go far, just within your space. And I do my own bits, it adds up. Everything adds up at the end of the day.
Yeah, my colleague over there has a question for you.
All right, Doctor, I'd like to, because I remember that while growing up, we had this notion, not a notion, but we had this regimen of Darapin, Sunday medicine treatment. So what has changed since then, especially now that there are more advocacy, more available treatments for malaria? So between then and now, what has changed? And people still, do they still go through that regimen of, in preventing malaria, and also the use of ITN, the treated nets? What's obtainable at the moment?
Well, the nets are what is actually obtainable at the moment. We don't use Darapin again like was used in the past because of resistance, like I mentioned. We really don't use medications to prevent if you're not pregnant. The only way for prevention for us now is use of nets and the environmental management. There's also what we call level source management. That's level source, the mosquito larva, just so that you get rid of the breeding sites. It's a broad terminology that involves environmental modification, environmental manipulation, the use of larvicides, and Once our environment is okay, we don't have the breeding sites, then definitely we are getting rid of the mosquitoes. But in terms of medications for ourselves, we don't have what we call prophylaxis, apart from sulfadoxine pyrimethamine, which is being used by pregnant women, SPs. There's no preventive medications for individuals.
It's just for pregnant women
Just for
because they are
pregnant women,
vulnerable.
they're vulnerable. And research has shown that it's quite good on them. It prevents malaria in them.
So what are some of the biggest challenges that you've experienced in the course of your duty in fighting malaria in Lagos, and how would you want residents to also help in the fight against malaria?
The biggest challenge is actually behavioral change. Us, our ways. Many of us do not realize that the little that you're doing will go a long way. Some of us will see a dustbin and we have rubbish in our hands and we throw it on the floor. I do that, you do that, the next person does that, and it goes on like that. Eventually, I have a heap of rubbish right in front of me. The rain falls. That rubbish gets to the nearest drain and blocks the pathway for water to pass. Eventually, there's flooding. Now, it takes time for the floods to disappear. While it's trying to disappear, the mosquitoes come and breed there. And before it goes, it has become adult. It doesn't take days. About 8 to 10 days, you have your mosquitoes, and then they start to move around, and the cycle continues. Why I'm saying behavioral change is because it's quite a lot of work for us to convince individuals that you need to ensure that your environment is clean. You also need to ensure that once you have fever, it's not malaria. It doesn't necessarily have to be malaria. I need to ensure that I test before I start any form of medication. And I have to decide to know that I need to test. Some individuals will tell you that, look, I know how malaria is on my body. Once I taste, or once it looks like this, it is malaria.
My mouth is bitter.
There are other causes of bitterness in the mouth. Fever is not peculiar to malaria. Fever is, once you have an infection, fever most times, the infection will present with fever. But you need to know which kind of infection it is, malaria being one of them. So it is important we need to test. So the biggest headache really is behavioral change, having to convince people to do the needful, sleep inside your nets. There's a reason for it. Some individuals will tell you that, look, it's hot. But you know how much it is to treat malaria. I'm not even talking of the monetary aspect, the time aspect. We haven't quantified, or we have not monetized how much time you spend. If it is you as the individual, how much time you'll be away from your work. And if your work is such that your money has to come in daily, or you have to be paid daily, how much time you have to take off to get better. If it is a family, and the parents have to, you know, a child has to be admitted, it means other children, if there are other children at home, attention is diverted from them. The child in the hospital is the center point at this time. What happens to the ones at home? If there's no extra or external persons assisting in taking care of them, would they be able to go to school? Would they be able to do their normal activities without having to consider the fact that they have a sibling on admission? We haven't looked at them, and then the parents cannot go to work as expected. We haven't looked at the economic implication of having to treat malaria, and then you now talk of the discomfort of, you know, malaria. Mosquitoes are kind of uncomfortable. When we begin to understand the implications of not preventing malaria, then we would realize that we are spending a lot more treating malaria than it is to prevent.
Yeah,
writing on that question. Your response, I know you're big on testing, but we know that a lot of people are also big on self-medication in Nigeria and Lagos. So how do we begin to deal with issues surrounding self-medication and purchasing OTCs, over-the-counter drugs, to treat malaria? And how do you also intend to cascade this to the communities to disseminate this information?
Like I mentioned, behavioral change is big. Having the individuals understand that testing is not just about you wanting to know what's the problem. It's not just about you, you know, inconveniencing yourselves when you know that, you know, it's malaria. Testing is to find the root cause of the problem. Supposing it's not malaria, supposing it's an infection, another infection, maybe a viral infection, and then you're taking medications unnecessarily, it means you're putting your body under work unnecessarily because you haven't treated the root cause. And then the problem now becomes severe, resulting in an admission or something worse. It has to, individuals have to understand that you're not doing anybody a favor but yourself. So the importance of testing before medication or before treatments cannot be overemphasized. What I would encourage is everyone should ensure that you get tested. There's something. In fact, I was listening to a conversation this morning, and you mentioned, which is usually what happens, a situation where they tell you that if after 3 days you don't get better, consult your doctors. That is a wrong notion. You don't start medication before you start consulting your doctors or any health personnel. You need to find the root cause of the problem, and then you treat it accordingly. So that way you prevent yourself from, getting untoward effects prior to the time the problem is resolved, or even getting your body in place or ensuring that your body does not undergo unnecessary stress in trying to solve the problem. So those are the things that I would actually want to, encourage.
Yeah, over the counter?
In terms of over the counter, one way, I'll still say it, the individuals that are selling the medications, if they insist on seeing the test results before the medications are being sold, it will go a very long way in ensuring that people do not self-medicate or just buy drugs arbitrarily. If I get tested and I see that it's not malaria, that means there's something else that is the problem and would cause me to want to go further to find out what the problem is. In the course of it, I discover that it's a viral infection, and I go to the pharmacy. The pharmacist will probably tell me that all you need to do is just to rest for a bit, take some, analgesics like paracetamol, and then after a while you get better, which usually is the case. So I have prevented myself from taking medication that isn't required, and I have treated the root cause, which is a viral infection, which would eventually go after a few days, and I will get better. But what we have to keep re-emphasizing the need, and until people realize that behavior, you have to change it. To ensure that we do the right thing before we can actually move forward.
Thank you so much, Dr. Abimbola Osinowo, for an in-depth, conversation talking about malaria prevention, treatment, and management in Lagos. I have learned a lot today, and I hope that you have learned a thing or two from our conversation today. Thank you so much. She's the manager, Lagos State Malaria Elimination Program. Thank you so much for your time on the show.
Thank you so much for having me.
The conversation continues after this. Stay with us.